see what care we can give at the site. Site means on the, for example, in the public place, if it is happening, then on that particular place, what care you can give to the patient on site, that is a site care. Next is care during transport. So what is this care during transport? So at that particular site, so for example, you think bleeding is there, massive bleeding is there for the patient, and there at particular site you will control, you will tie something, you will give apply pressure, and you will somehow you will control hospital. So how, what care, whether you can live like that? Once you are giving care, then you will leave the patient like that? No, isn't it? So care has to be given. Then what care during the transportation has to be given? That care has to be given to the individual. Okay. Next is the hospital care. So that is the last. Once you are shifting the patient to the hospital, then in the hospital the care has to be given to the individual depending upon the protocols of the hospitals. Okay. Next. You see some of the common emergencies. In that today's class we will be studying only cardiac arrest. Okay, BCLS module, it is a mandatory module. So many emergencies are there. Hope you all studied in first year, first aid module, isn't it? Anyone from the class? Any difference is there? First year. Who is responsible for pumping of the heart? SEM. So they are the electrical activity, isn't it? They are the natural. Only our heart, the chambers of the heart will be contracting and relaxing. So the pumping action will be taking place. So if the pumping action of the heart stops, okay, if the individual becomes pulseless, then we are calling it as cardiac arrest. What is heart attack? Medically we call it as myocardial infarction. Heart attack. Heart is supplying blood to the whole body, isn't it? Who is supplying blood to the heart? Coronary arteries. So if there is a block in the coronary arteries, then the oxygenated blood supply to the myocardium is not taking place, and the cell death will be taking place, and that is called as myocardial infarction. Here also the heart will not be functioning, the cell death will be taking place, then that it is called as infarction. Okay, so here in cardiac arrest what happens? The electrical activity will not be taking place, and the individual and some other causes also will be there, and the individual will be going for crash or the cardiac arrest. So this infarction, it occurs when the blood flow to the portion of the heart muscles is suddenly blocked, okay, causing decreased oxygenated blood supply, leading to the death of the myocardial cells. So that is the difference between the cardiac arrest and the myocardial infarction. Next, objectives of this cardiac arrest. See, it is not like this. The hand should not become like this. It should be very straight. It gives CPR like this. Your shoulder should be very perpendicular to the patient's body. If you imagine this is the patient's body, you are placing the lower one-third of the sternum along with the nipple line. Your heels of the dominant hand first you will place, then heels of the non-dominant hand. Heels of the dominant hand, over that heels of the non-dominant hand. Your elbows should be very straight. Right hand. Right hand. So the dominant, some are left hand is there, no? Usually right hand. The dominant is right. So place should be very straight. Very stiff also. Lock like this. So once you have placed, then lock it. Okay? Lock that, then you have to give the compression. Your chest should be perpendicular to the patient's body. Patient's body is there, should be very stiff, and have to give CPR. Everybody just give compressions. Very effective. Okay? Once again, we'll do take the position. Dominant hand over the non-dominant hand. first you will be doing the assessment. So in that, what are all things you will be doing? Patient is awake or not. Stimulation, you can give the painful stimulation for the trapezius muscle pinch. Okay. Then after that, patient is unresponsive. So you will be declaring cardiac arrest. Immediately you will be giving the position and you will be starting the CPR. Okay. So where you have to place your hands? If this is the sternum, lower 1/3 of the sternum, you will be between the nipples. You will be placing your dominant hand, okay, over the non-dominant hand. Your elbow should be straight and shoulder should be perpendicular. Then you will be giving the compression. So in 1 minute you should give 100 compressions. So while giving compressions you can count, okay, 1000, 1000, 2000. For your count you can count, okay. AED machine is arrived. Then you will be attaching the wristbands. Okay. One is below right side, below the collarbone. Then another one is left side, below the chest. Then according to its this instruction, it has to be, you have to follow the instruction. So
apply pads as shown in the pictures. Apply pads as shown in the pictures. Press pads firmly on skin. Apply pads as shown. Advised. Do not touch the patient. Everyone clear. Press the flashing shock button. Shock delivered. Begin CPR.
So again you have to be giving the CPR. So it will be giving the instruction. That instructions has to be
10,
followed.
20, 30. Give 2 breaths.
Again it will be giving the instruction. Meanwhile, if any ambulance, if anything is arrived, you can shift along with the AED to the hospital.
10,
Okay, so you have to follow the instructions of the AED machine. Okay,
20.
understood?
30. Give 2 breaths.
Once it is 30, they are telling you have to give 2 breaths. So you understood how to give CPR. Okay, first you will be analyzing assessment. After that you have to place it.